My name is Nancy Sandrock. I'm a certified nurse midwife, been in women's health for over 25 years. I'm here to tell you about teratomas. There are different types of teratomas is the first thing for you to know. The one for the purposes of this video and this production are going to be ovarian teratomas. These particular teratomas are ovarian cystic teratomas. The other name is dermoid cyst. What happens is there's a germ cell that starts out the cyst, and those cells are dermal origin, meaning they're from the skin. So there's ectodermal, which is the brain and skin. There's mesodermal, which are muscle and fat. There's endodermal cells, which are like mucous membrane or ciliated epithelium origin. So all of these different dermal cells are typically what we would think of skin cells. What happens in a teratoma or dermoid cyst is that you may have any kind of combination of hair and skin and even teeth and fluid, just depending on the exact composition of the cyst. So these are your own cells that develop, and they can happen in young girls. There's been lots of studies done. Girls between the ages of 8 and 11 and even older have been diagnosed with them. The presenting symptoms would be related to where the cyst is located, and of course in the case of an ovarian type of a cyst, it would be on or near the ovary. So any type of abdominal pain that doesn't go away and doesn't seem to be related to like a urinary tract infection, a bladder infection, or any constipation or gas or GI type of a trouble, then you might want to get it checked out. People don't typically think of something ovarian related to a young prepubescent girl, but it really has nothing to do with the function of the ovary itself. It has to do with the location of where the cyst forms.
Well, the first time I took Michaela to the doctor didn't know what it was. He just thought it was like a growth spurt or something. And then he decided to do some testing. We did a CAT scan, an X-ray, a sonogram. All of them came out, all of them are not sure what it was. So they basically said there was a cyst in her ovaries. And they recommended a specialist. So we went to a specialist. His name was Dr. Celso Rodriguez. Dr. Rodriguez looked at it, recommended that we do an operation since she had a tumor in her ovaries. We were concerned because she was so young. She was only 9 years old at that time. Because Dr. Rodriguez had mentioned that he might take her ovaries out. So we were concerned, and we wanted to get a second opinion. And Dr. Rodriguez said, well, if you didn't bother to come here the first time, I told your wife, then why should I explain it to you again? And he was kind of rude about it. Dr. Rodriguez said, okay, if you want a second opinion, I'm no longer going to be your physician. We did an operation on July 13 of this year, and she managed to take out the ovaries. She managed to take out the tumor, but keep the ovaries intact.
When I told my dad about my stomach pains, he gave me the same reaction all the time. He gave me Pepto-Bismol, Pepto-Bismol, Pepto-Bismol. And he told me I was constipated. Also, my mom told me I was constipated. And he told me I needed to go to the bathroom. But when he gave me Pepto-Bismol, it didn't work. So later, he told me that he thought it was part of becoming a young lady. So he gave me Midol for teens, and it didn't work. So later, my mom took me to the doctor, and they told me I have a cyst. I didn't know what a cyst was, so they told me that I had a tumor inside my ovaries. I was scared and nervous and afraid most of the time. and they had to do surgery on me, and I didn't know what was going on. I had 3 tumors, 2 on the right and 2 on the left. One of them looked like a big grapefruit, and I was shocked because it had eyes, hair, and teeth, and most people told me that it was my second twin, and it was cancerous, and I was also shocked. I was really nervous, and I went to San Antonio so they could do the surgery on me. I had my little unicorn with me to help keep me calm, and the surgery was a success. I kept my ovaries, but they removed the tumor, and I was back to my normal self.
It was 7 years ago, but I could still remember the pain, just very sharp pain, I guess. The day before surgery was the first time that I had any symptoms, so whatever had been building between, I didn't know until it was at the final stage. The symptoms, I had extreme vomiting, even though there was nothing to vomit. It was just constant gagging, I guess. And extreme cramping in the abdominal area. But it could have been anything. It could have been menstrual cramps, could have been anything, right? Those were just the 2 biggest things, and extreme dehydration. I was just vomiting nothing, that there was something that my body was trying to get rid of. So I go to the emergency room, and I spent an entire night there waiting with the night shift. I wasn't even in a room yet, it was just kind of been waiting. And they deemed me dehydrated, so they sent me home. But the symptoms kept going. I waited for a long time. As soon as I woke up in the morning, it was 11 a.m. Nothing changed at all. If not, I was weaker and terrified. And they called from the LMC saying I had to go and do emergency surgery, and they couldn't explain over the phone. So once I get there, they told me I had an ovarian cyst the size of a mango on my ovary. They told me it twisted, so it could have been, the doctors weren't clear, it could have been months, years, or days that it had been decomposing, probably not years, but decomposing in my body, and I was hemorrhaging apparently. So the ovary was completely gone because it had no blood flow, so I lost the left ovary.
Well, my sister was 9 years old. She had just turned 9. It happened this past April, and at first my mom assumed that it was appendicitis because my sister had been complaining of a stomach pain, like a very profound stomach pain, but my mom just thought she was exaggerating. And then my sister, I guess out of frustration, kicked the door, and that kind of set the pain at its all-time high. So then she starts throwing up. So then my mom takes her to the doctor, and they tell her to go to the hospital because she needs to get her appendix removed. And so they do that. And then that same week, the symptoms return. So then we go straight to the emergency room, and they won't attend her for an abundance of hours until very late at night after being there for a really enduring amount of time as well. She had just been throwing up, and finally they took her in to do some x-rays, I want to say that following morning, and they found an ovarian cyst, and our concern was whether it was cancerous or not, but it turned out to be benign. But it was weird because she hasn't gone through her period yet. So all of us were kind of concerned because the doctor described it as if it was the size of a grapefruit. So all of us were kind of mind-boggled, like why would we know about this sooner? And he just assumed that she was very tolerant of pain until it just couldn't anymore and it was about to burst. So they surgically removed the ovary because they said that they couldn't remove the cyst without surgically removing the ovary. The doctor did mention though that there is a chance of the cyst returning And it had teeth and hair as well, so we were really concerned about that. But he just said that there is no promise of it either returning or not returning, so it's just about, you know, playing it by ear. I feel like the hospital here was just kind of looking for the easy way out about it, and maybe they hadn't really been exposed to something such as that, because I want to say that they had said it was rare for people, or rather girls of her age, to get it, as well as to get it not only at that young of an age but without having her period first. So I feel like they didn't really know how to approach it, so they just did the immediate thing. But I feel like maybe had we left out of town, maybe she would have been attended a whole lot sooner. Maybe she wouldn't have suffered as much as she did for the amount of time that she did, and maybe she would still have her ovaries today, or at least that one ovary that they removed.